Good evening, everyone. By the name Samomongin Joseph Leonard. I'm gonna be working on patients database management system, and this system is under health sector, and the possible database management systems in health sector include hospital management system, medical imaging management system, electronic health records, pharmacy management system, and patients database system. My choice was patients database management system. Why? Because I wanted to eliminate the use of manual data entry and paper records. Also want health professionals to access patients' records quickly, leading to more efficient and timely diagnosis and treatment. Also want this system to serve as a valuable resource for research and analytics. Maybe, for example, during those days of COVID, the researchers and analysts can use this system to predict the possible harm to come in the future for those people who are sick, who will get sick, so that the number is going to be covered. Application domain is to streamline medical workflows, support organization and retrieval of patient information, enhance overall health care management within hospital, clinics, and any health care providers. Supports the users of the system will be IT support staff, such as an analyst, patients, and also administrative staff. And what should I talk again? System requirements. The requirements of the system. The requirements are divided into 5. There is a system requirements, business requirements, users requirements, functional requirements, and non-functional requirements. And these are some of them. You can see the system requirements. System should define roles and permissions for different users, implement the encryption tools, and those are some of them. You also have their user requirements, and those are non-functional requirements in my system. You can see them. Business requirements are there also, and this be part of the question is how the system will help in accomplishing certain organizational managerial goals. This system will help in reduction in paperwork and manual recording, leading to cost savings in terms of paper, printing, and storage, since all the information is going to be saved in the servers. Increase efficiency in accessing patient data, reducing time spent on searching and retrieving information. Also, there's also improved the decision making and speed, leading to better patient care and organization management. And the analysis of costs. Analysis of costs are divided into 2. There is tangible costs and intangible costs. When I talk of tangible costs, these are these. This will include the requirements that I will need in my system, like the hardware and the software, the software licensing, training and implementation of this system. I also have to maintenance and support. This will require some good money for this system to be implemented. Intangible costs. This will be like productivity loss during implementation, change management efforts to address resistance to change and ensure smooth adoption of the system. I have to carry out some survey, encourage people to use the system, and there's some of the expenses that I will incur there. User issues. These user issues include skills, adoption, and effort. And in user issues, I have the data entry burden. For healthcare professionals, they may perceive this system in a different way, since they can perceive it as seamless thing to enter data, because they are not used to communication and training, intuitive design, accessibility of the system, and so on. Risk assessment. In risk assessment, there are some technical risks and organizational risks. And technical risks involve the technical risk, the risks that are involved in the system, like data migration issues, transferring data from this maybe oldest system to another. Maybe if there is some improvement in the system, data might be lost. Data integration with the other systems, maybe also technical compatibility due to hardware and software issues. The problem might also arise there. There is also organizational risks. Lack of user training is one of them. Insufficient training program leading to users not fully understanding the system, so some money will be incurred to train the users on how the system will be implemented. Resource constraints, communication breakdown, the limitations of the system, the connectivity issues, since the system relies on the internet for it to work well. Maybe if there is no internet, the system cannot work. Also, if there is no power, electricity power, the system cannot work. Yes, meaning information cannot be accessed sometimes due to such issues. Information can also not be accurate because some patients can try to hide their information. And here I have my entity, whatever diagram table, where I have entities, attributes, and keys. For example, the first entity is login table, where I have password, username, email address as my attributes, and the keys is primary key. Patient, I have patient ID, first name, last name, date of birth, gender, and the primary key is patient ID. I have medication there with its attributes, medical providers with its attributes and keys, appointment. And down here I have my ERD diagram, where I have login password, where a patient can access information when he logs in. When he logs in into his account, it is a patient who also owns the records, and the medical provider writes to a patient. It writes to the records, is the one to write the records. I also have the medical provider who offers medication, and patient receives medication. I also have the appointment, whereby a patient can be appointed, can appoint a medical provider, and just like that. And these are some of my queries. That is my database. My table, my attributes are there. Some of the tables I try to work on. Yeah, some of the examples are there. As I come to the end of my presentation, I want to thank everyone for listening to me. Thank you very much.